Hi, my name is Amy Kossik. Just to give you just a little bit of background about me, I am an infection preventionist for a 900-bed academic teaching hospital in Reading, Pennsylvania, and I've been doing infection prevention for about 4 years now. So my top concerns in healthcare, number one is absolutely mental health. I know years ago we moved away from the state mental health facility model, but I don't feel as if we've come up with a good solution for our patients who have mental health issues and are out there in our communities. Number two is the number of uninsured and underinsured people, because I think it makes healthcare not accessible to everybody, and it makes it very difficult for people to get the healthcare services that they need, and they end up not getting the preventative care that we hope everybody should get, and they end up sicker and they come to the hospital sicker, and they really can put a strain on our resources, and it's also not good for the patients. If healthcare was more accessible, we might see fewer chronic diseases and better outcomes for our patients. Number three is cost. Even for people that are insured, the costs can be astronomical, which can prevent people from seeking healthcare when they need it. So one example that I like to use is that even though I have worked in healthcare for the last 8 years, I did go out of network to get an MRI done. And I got a bill for that MRI, and it was about $2,000. And I was a new nurse, so I wasn't making great money yet, and $2,000 when I had just started paying rent and doing things on my own as an adult was just not accessible for me. And it put a big strain on me financially at that time. And I have pretty good health insurance. I definitely know that, and I can't imagine what some of those costs can be for people that don't have good health insurance, like people that have state health insurance or just not good health insurance in general. They have their own challenges. Number four is tying insurance to employment. So that causes a lot of issues when people lose jobs or change jobs. So I know right now, during the COVID-19 pandemic, that's a big issue because there were a lot of people that lost jobs and now don't have health care because of it. And health care that's not tied to your employment can be very expensive and inaccessible for a lot of people. Number five is insurance restrictions. So I have not personally experienced this, but I know that there are a lot of insurance companies out there that put a lot of restrictions on the type of care that people seek out. And actually, now that I think about it, I have experienced it, because when I first started out in nursing, I worked about an hour away from where I lived. But because of my insurance restrictions, I could only seek care without paying an extra amount within my healthcare facility, which was an hour away from where I lived, which is why I went out of network for my MRI. So it can make things very difficult for people that do have insurance to be able to find healthcare or the healthcare that they want and need within the restrictions of their insurance providers. Number six is a drive towards productivity in healthcare. I did experience this when I was a nurse on the floor caring for patients, that you are pushed to see more patients in a shorter amount of time so that you can get more patients on the bill every day. I know when I was pregnant with my first daughter, Lily, one of the OBGYNs told me that she was constantly getting bad reviews because she would go over her 15-minute time slot that she was allowed with each patient. And she would sometimes sit with a patient for an hour if that patient needed to speak to her for an hour. And she was by far my favorite OBGYN that I saw. And I didn't mind sitting in the waiting room for a little bit of extra time because I knew that I was going to get that time back when she saw me. But I also know that she was constantly getting reprimanded for it, and she was even seeing some financial repercussions for it, which I think we need to think about, because in healthcare, we're here to care for people, not to just push them through a line. Number 7 is the nursing shortage. I have experienced it in every place that I've worked, that there's always a shortage of nurses, and it's difficult to find new nurses to come in to staff. And I know that those nurses they aren't necessarily graduating, they're not there, or they are graduating but they're in a different area and not where they're needed. And that ties into number 8, which I call brain drain, and that's the nurses that are taking care of patients and are doing bedside care that are just getting overworked and are getting fed up with the environment that they're in, and they're starting to look towards moving away from the bedside, which I will admit that I am guilty of, but then it's leaving the bedside understaffed. Number 9, HCAPs, or moving towards pleasing the patients. I fully agree with having a bar to set for all facilities to be able to provide the same standard of care, but there are times where it feels like we're trying to please the customer instead of provide good care, and I think we need to scale that back a little bit. And then number 10 is technology and cybersecurity. So with technology comes a lot of technological advancements that we always have to stay on top of, and then it raises issues of cybersecurity, and having all of that private information there where somebody can hack in and access it. With the clips, I really enjoyed the first clip to go along with that technology and to talk about technology advances. I definitely think it is the future of healthcare, but there are good and bad things to it. So some of the good things are that it helps the people that are health illiterate, because you can tap into what they're doing every day. So if you ask them like things about how they felt, they don't necessarily need to fully understand you if you're able to tap into their hormone levels and their vital signs and all of that stuff. Like, it gives the healthcare worker some insight into how that person is doing on a day-to-day basis. And it also provides a place where the healthcare worker can go back to and point out, like, hey, do you remember when this happened during the day? Well, that's what I was talking about. And I think that can help to kind of close that gap there. It can also make healthcare more proactive. If there are things that we can pick up from having a heart monitor on constantly, or checking hormone levels while we sleep, and we can do something about it before it turns into a bigger problem, I think we can see a lot of good from that. And it really involves the patient in their care, especially because they're involved 24/7, and we can see what's going on 24/7. And I think that involving the patient in their care is extremely important. But I also think that there can be bad things to it, which makes it kind of scary. It is kind of an invasion of privacy to have somebody be able to look into every single aspect of your life 24 hours a day, 7 days a week. That's a little scary. And I feel like this kind of information could potentially be used against us. Like, for example, from insurance companies who are trying to find reasons not to cover us for something. So there's definitely good parts and bad parts to that. My health insurance, I know I am very lucky working for a hospital that I have fantastic health coverage, and I have low copays, and I don't spend a ton of money on it. I looked and I pay about $456 a month. I know my mom, who does IT kind of stuff for not a healthcare agency, she pays close to $1,000 a month for just herself, and my $456 is for my whole family, my husband and my daughter. So there are definitely some huge disparities there. My dream for nursing is to find a solution for nurse-patient ratios. I know that some states have done state-mandated nurse-to-patient ratios, and that can bring on its own separate challenges. And then you have states where there are no ratios, like here in Pennsylvania, and sometimes it can get very dangerous. One of the reasons that I left the bedside was because I was working on a med-surg unit on night shift, and I was taking 9 to 11 patients a night, and I didn't feel like I had help and support, and I felt like it became very dangerous, and I wasn't comfortable in that environment. And I know that that is seen in many other places, and somebody might listen to me say 9 to 11 patients a night and think that's nothing, but it was a lot to me, and I felt like it made my job very dangerous for me and for the patients. So finding a solution to meet somewhere in the middle, I think that's my dream. My favorite quote is from Ruth Bader Ginsburg. She says that women belong in all places where decisions are made. And I live by that quote. I love it. I know that not all of you are necessarily women, and that's okay, but nursing is a very female-centered field, and there are a lot of us women out there. And I think that it speaks to the empowerment of women, and I'm sure all of you women that are listening can relate to that, since you're all pursuing advanced degrees and you want to do something different, and I think that's awesome. Dr. Berwick's speech was very emotional. It really hit home for me. I didn't know him before, but he's definitely become one of my favorite physicians now too, because I believe in the things that he believes in. He talks about moments of poetry in your profession, and I think that that's something that we always need to remember, is there are tough times, but there are those moments of poetry too, and they can really make your career worth everything. And his talk about Isaiah was amazing, because it's absolutely true, and Isaiah, unfortunately, is not by himself. There are so many patients out there that we don't think about anything going on in their lives outside of the disease. And that's something that we really have to remember, is that we have to treat the whole patient and not just what ails them. And 2 to 3 changes I've seen in healthcare delivery. So I started my career at a small community hospital in the Poconos in Pennsylvania, and it was very centered around private family physicians that saw their patients in the office and then saw them in the hospital. And while I was there, they moved towards the hospitalist model, which was a big change, and there was a lot of troubles from the patients with that, because they wanted their doctor and they didn't fully understand, but I understand why that change happened. And then telemedicine, especially with the pandemic going on, moving away from face-to-face care towards telemedicine is definitely a big change that is currently happening, and it can change a lot of things that we know about healthcare. So it's great to meet all of you. I look forward to sharing this semester with all of you.